Hello and welcome to another episode of The Everyday Leader. I am your host, Dr. Hanna. Today's guest is a trailblazer in African surgery and a powerful advocate for women in medicine. Dr. Hanna Getachew is one of the few female surgeons in her specialty across the continent. She is an associate professor of pediatric surgery with over 15 years of clinical experience and numerous academic publications to her name. Beyond the operating room, Dr. Hanna has held influential leadership roles throughout her career, from serving on the executive committee of the Surgical Society of Ethiopia to chairing Women in Surgery Ethiopia, and now leading as chair of the Examination and Credentials Committee at COSECSA. Her journey is one of resilience, excellence, and transformative leadership. So I'm so excited for this. Let's dive right into it. Dr. Hanna, welcome to the Everyday Leader.
Well, thank you, Dr. Nanania. Good. Thank you for having me in this wonderful platform.
Yeah, it's good to have you here. It's been a while, and I'm so glad I get to see you because of this excuse.
Yeah. Same here, yeah.
So let's start with the heart of the show. What does the Everyday Leader mean to you? And can you share any moments from your journey where you embodied leadership long before holding any formal titles?
Yeah. So as a surgeon, right, like when you see ourselves in our everyday life, even if you don't have that formal leader role, surgery is about leadership. So you lead the team, the surgical team that you have every day. So it means, like you don't need to be like, you don't need to have the name of a leader to have that role. So I can see in everyday life we do embody that role as a leader in everyday life. So normally, like, if you are not, even if you're not given, the exact name of a leader, I would say, like, as a, like, I think maybe some of us are give like have a character or a given specialty that we do have that responsibility or an integrity, that it's a kind of a mindset that you need to lead something, right? So you don't need to be given as the role, the name a leader, but in everyday life you do it in any way, like in theater, with your colleagues, even in your daily life, in family life, you do that role every day.
Yeah, I completely agree. I think a lot of people think leadership is the title or the position, but it really is not. And it's important for people to know that leadership is something that you experience every single day. Just leading your own life, that is leadership, you know?
Yes, yeah, that's true.
Yeah, so without the fancy titles and, the big office and this office chair and everything, you're still a leader. So I love how you describe that. So like I said, were there moments on your journey where you didn't have the titles, you didn't have anything, but you realize, oh, okay, I am leading, like this is me in a leadership role? Was there any moment like that?
So I don't recall any specific moment that would say turn me into a leadership position. But I said, even like after I did my undergrads at Gondar University, and I did my general practitioner time at Minilik Addis Ababa. So by by that time, we've been involved like into different positions as as just a general practitioner, right? But you'd see leading the theaters, right, and it also organizing everything. There was a time that there like tensions in the country where there has been, you remember the moments by then around 97 Ethiopian time. So we were I found myself leading the team in organizing, that trauma time. So I think I realized by then that I have that role of leading if I get a chance in the future. So, and then after that, it's just the history that I can do it. I can do it better. If anyone can do it, so you do it better. And then that came into an action when after I did my ped surgery. So I was a lecturer in the departments of surgery, which is a giant department in the country at Addis Ababa University. So, and then I became the deputy chair of the Department of Surgery. This is where I do have that leadership role. The name leadership role has been given to me, and then that department is full of male, right, full of experienced people. So, and then you are the young female surgeon in the department. So, and after that it will be just a flow of things. So yes, I can do this better. Sometimes you would say, okay, I can do this better in a better way without imposing anything to your leaders, right? So that I think that it's just not a single moment. It's just a stepwise thing that came into the role of leadership.
Yeah, that's great. I love how you mentioned that your first role as leadership was when you were just starting off your career as a doctor, and you were kind of pushed into it because of this very stressful environment and situation. Anybody who's gone through as a medical doctor during wartime understands the pressure and the uncertainty that surrounds it. So it's very interesting. I think it takes a lot for someone to step up when it comes to such demanding and stressful environment, work environment. So I think that would definitely make somebody realize, oh, okay, I can lead because the pressure is just too much. It's a high stakes situation. Um, so take us back to the beginning. What shaped your path? I don't know. Let's start from your childhood to being a medical doctor, a surgeon, and what pivotal moments defined who you are today?
Yeah. So I would say, when I grew up, my families are teachers. My mom and dad were teachers. My dad was a university teacher, a kind of college lecturer, and also my mom is a teacher, even up to date. So they keep us pushing us. Most of our, if you see most of the doctor, if you see most of the for example yourself, right? So it's a like previously it's a push of the family when you are very young to be a very good student and then to pursue in either medicine or engineering or some other pilots that they think is right. So but and then that push is there. So it used to be like sit down and study. So my mom is also, giving an example to my kids that, oh, your mom is to be like this one. So you have to just come home and then read. She kept telling them this, that. So for me to like, okay, I would say, we want to be a doctor, but the time comes when we do have, neighbors. We used to live in a kind of a townhouse, right? So, and the next to our house, there was five female doctors actually, who used to live together. So one of them now is a gynecologist, in Yakati, and then went to Hemen now. One is a famous ophthalmologist now. She's a pediatric ophthalmologist. I think got one radiologist, and then the other two left the country. So I used to go to their house, and I used to see them like, these neat, tiny doctors that used to be. So I said, oh, now I want to be a doctor. So, and then that, I think that everybody asking me about how do you become a doctor, I think apart from my families, they are the driving factors. They were my role models to be like a female doctor, like as a young thing. So, and then came, yes, we continued to push, and then I joined going to university. And then after that, I used to love surgery. So actually I wanted surgery. So I wanted to, to be a GP in Gondar, but the surgery department doesn't have vacancy by then when we graduate. So I've applied to orthopedic surgery. So, and then, I said, okay, the orthopedics might not be for me. So I just, I get an opportunity to work in Addis at Minilik. By then, only 3 or 4 of us will be assigned in town. The rest was going to the countryside. And then my journey to be a surgeon. So, I used to love surgery. So many like interesting mentors in surgery while we were at Gondar University, like Dr. Mansour, the late Prof. Amazana, and then Dr. Zeki was, they were my, my role models to be like to say, okay, I want to join surgery. And then after, like I was doing also a surgery rotation as a GP in Melili. And then when I said, okay, I will be a surgeon. So in the country, there were only 2 practicing female surgeons in the country, Dr. Aster and Dr. Firdosa. And there was other one Eritrean female surgeon. So, and then that was it. So only the 2 of them. So nobody knows about whether a female can be a surgeon. Even those doctors who were neighboring to us. So Dr. Raponesh was an ophthalmologist at Minilik. So she was pushing. So no, don't be a surgeon. You will have a back problems. And my mother also was against of me being a surgeon. So, but like I said, okay, why not? So but I keep pushing that, I want to pursue my career as a surgeon. So, and then I joined surgery, where I found that there was another female surgeon in my batch, and then also one prior to us, which it will be the first cardiothoracic surgeon in the country. Dr. Mahalet was our senior. Actually, when we joined, we found to see her. So I did my surgery with another phenomenal surgeon, Dr. Titena. So, and then that was the journey, the pushes that like I wanted to pursue surgery. And then after that, we did our surgery. I just wanted just continue to see, like, okay, I say during our pediatric rotation. So you see in pediatrics, you see the cases there, they will be sick for sure. But when you do things in the right way at the right time, you see them changing. So, okay, I said I would want to join pediatric surgery. And then we do, when you in life, everyday life, we have not only female mentors, right, and the female role models. Because some of us don't have female role models because of a few number. So by then, as I said, also Professor Miliad were there, Dr. Balacho, and then Prof. Amazena were there for us to be inspired to join pediatric surgery. And me and my colleague, we were the first fellows of pediatric surgery in the country. So, and then that's it. Like how my academic career went on from being a young girl to to now a pediatric surgeon.
Wow, that is so interesting. What are the odds that you would have five female doctors next door? That is almost, I mean, probably too wide. Mathematically, it's almost impossible. So that is very interesting. And then I love how you mentioned your parents were pushing you to be a doctor, but your mom didn't support you become a surgeon, which is very interesting. I wonder why. I mean, do you know why?
No, she said, it's tiresome. You'll have a back pain and then everything. So now when she saw me like going through like a busy time, she would say, I used to tell you not to be a surgeon. Yeah. So that thing. So it's just that like she doesn't want me to be like tired and sick. That thing. That's the main thing. That but being a mother.
Yeah, true. You do want the best for your children, that's for sure. So that's interesting. Um, that's a very inspiring story, and I don't think a lot of people talk about it enough. How hard it is to be the first or the first few of something. It's the fact that surgery on its own is a challenge, and then when you're being trained surgery in a resource limited setting, and then being one of the few women, literally, and that is a different layer of challenge that a lot of people wouldn't necessarily understand. So it's very interesting. So as a pediatric surgeon, you serve, one of the most vulnerable members of the community, and it often means carrying the weight of others and watching them suffer and things like that. So how do you stay grounded amid that emotional intensity? Does faith or personal philosophy or community play any role in your resilience through this journey?
Yeah. So, like it's one of the hardest specialties, I would say, is, like pediatric surgery would expose you to a lot of things, like human fragility, because, sometimes you would get a very sick baby, right? And then the 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 outcome would be very good. So I would say, like, and as a person, I'm a very emotional person. Like I can cry anytime. It's not like if it's not that you can see like as a my residents would see me like to be or not be very hard on them, but I can be hard when I have to, right? But if as a human being, I'm a very fragile person when it comes to my patients, right? So like I always do right. And then so as the ped surgical team as a whole, the pediatric surgical community is a very dedicated community where back in Addis Ababa University, Black Line, right? So yes, there are moments that we break, right? So we cry in theater. There are moments you do fragile, and then there are moments you come home with your patients, and then my husband used to drop me every day and then bring me some of the times during the cold times, and then later he would say, oh, why didn't you finish these things at the hospital, you know what I mean, right? So there are these things that it's very difficult in ped surgery, because you're not dealing with only because as an orthopedic surgeon also you do operate on pediatric patients, right? So you don't treat only the patients, right? You also treat families' emotions in ped surgery. That's also a very difficult matter that you deal with every day. Sometimes as a parent you would understand that parents might be fragile too. So it's difficult. So with time, but you would get there, I would say, right? So but you need to have a support system with you. I remember one time, so I went to attend a friend event actually, and I was called to see a patient with a foreign body aspiration, and then it was a charcoal, and then we removed it, and then the patient had a pulmonary edema. So, like, it was a difficult moment, and then we lost the patient by then. So, like, I felt so bad. We managed to get there on time and everything, but because of the course of the disease, the patient couldn't make it. So I cried. I just pick up my phone to call. I think Titina were middle by then. So my colleagues to say, okay, this happened, and then we discussed, we talked about it, and then you would get, so, like, yes, you have a support system as a, like, with families, you come and discuss with families, and also very importantly your colleagues, right? So you discuss because you understand each other. You discuss, and then you let it go, and then you work together. So I would say, I wouldn't say like I'm a spiritual person to have that ground for me, but usually, when you have patients, and you think, as a surgeon, you think that, oh, this thing might happen, okay, oh God, you see, you pray for sure, but it's not like, am I not the kind of person who go and then do spiritual basis, but for sure you do pray as as, like, yeah. And also, I believe in a support system of having good colleagues everywhere. So you might be, I might not be in town or outside, so, but you call your colleagues. So that is a very important system to balance, work and then life, and then your also your emotions and mental health at the same time.
100%. I completely agree. I love that you mentioned those things because pediatrics, I love pediatrics. I almost did my fellowship in peds ortho. Unfortunately, there's no money in it. Huh?
We don't say no. We don't say there is no money because young generation will listen to us, and then we want everybody to be pediatric surgeons.
Yeah, I'm just
Yeah.
being honest. Sometimes you have
Yeah,
to
no, for sure. Yeah.
have all the information before you make a decision. So, but um, yeah, but I love pediatrics. But the one thing that also did not make me go into it is watching parents bring children, especially in Ethiopia. Like in Africa, I think it would be mostly the same, where people might have 6 7 kids in the household, and they bring their kids, and that kid is, in a not a good health status. They're severely ill or something. They need an ICU, or they need uh, a life-saving surgery. Especially when it comes to orthopedics, it could be amputation. We have to, amputate limbs to save the life of the patient. And you just see the parents say no. And that procedure that's like 40 minutes long or 30 minutes long can save that life, that child's life. That child can grow up to be an adult, even though there is a part of them missing, but you're still saving their lives. And when parents say, "Oh no, no, if I'm gonna bury my child, I'm gonna bury them as a whole," which is a very cultural context. Um, so you don't know how to. You might try to explain it, but for them, that's their belief. So it's very hard to break that belief in that moment of high stress circumstance. So it's very hard to even connect with the family, because you're looking at the child and you're like, I gotta save this child no matter what. That's what your brain is going for. And then the parents, they're in a completely different mind space. So you can't even communicate, and you see children being taken home, and what's gonna happen next. So it's very hard. I'm an empath just like you. So I take my stress and my emotion back home, and it affects my home life as well. So it's really hard, and I think a lot of people need to be honest about this part, how you get emotionally invested
Mhm.
as a doctor and as a surgeon in your patient's life. whether it's an adult or
Mhm. Yeah.
pediatric patient.
Yes.
Yeah, but it's worse when it's a pediatric patient because they're not even making the decision on their own lives.
Yeah. Sure. Yeah.
Somebody else's. So
Mhm.
yeah.
Well, we don't have a law in Ethiopia, right? So to say, when you have parents refusing treatment for the kids, right? So, but like I'm currently based in Botswana. So there is a law that you can say no to a treatment, because the law would say that every child has a right to be treated, right? But as you said, it's very difficult to, if you don't have the law to protect the young ones, right? So it gives sense. You're right. Yeah.
Yeah. Um so let's cheer this up because I'm feeling down just thinking about it. You've held remarkable leadership roles, from chairperson of Women in Surgery Africa to your current position with COSECSA. So what drives you to take on these important responsibilities, and what impact do you hope to make through these positions?
So, as I said, my leadership role, the formal started from Department of Surgery at Addis Ababa University, right? To be there to lead, right, the department as a deputy chair, and also I was a chair of the pediatric surgery division there afterwards, and then that was the start of the formal leadership position. So I would say, I'm a surgeon, I'm doing the surgical practice. So when you see also others doing it, so the most important thinking that I have is, yes, it will take your time, it will take an effort, right? But the start point for me is to say, I can do this, right? So we've been there for long, so as I would say, I can do this thing. It's so that's the most important thing, that young people should believe in themselves, to say I can do this, as my male counterparts do it, right? It's not a competition, but you can say, or whoever did it before you, right, you would do it, right? So that is the most important drive. And then it came to, I haven't been a woman in surgery Africa chair, but Women in Surgery Africa has been there, but I just organized. Do you remember, you were there, and also Meti was there? So I said, okay, let's organize Women in Surgery in Africa. We were few, but not few, very few. So we have started a Women in Surgery in Ethiopia. We just went in for a few steps, because I think I would say most of us would think like, okay, why do we have women in surgery in Ethiopia? There was a few surgeons who would ask you, why do we need women in surgery? Like, right, we are like together. So yes, like I'm not an advocate, right, of a separate group, right? So I would say yes, and then they will that my trainees used to say, hey, Dr. Hanna, I think you favor ladies, right? So I say, no, I don't. My students are the same, like all the same. No, I don't favor that a woman, but like due to the many things that we go through as an African girl. So you need to be helped, right? You need to have a mentor, and then that's it, right? So, and then the thing is, so even medical students. So when a medical student, like he can say, is weak, and then if it's a guy, no, I don't like that, right? So it's because I believe they can push, and then they can do better. And then when you see medicine practice, internship, and then the likes, so if you see, it's not also, it's not the point that no, my our male counterparts don't do it, but the responsibility of a female medical student, also a female, I would say, other female physicians, um, is very, like, if you can give an example of female doctors excelling, right? So, and then I don't want like a female resident or female medical student to be weak, right? So, I keep pushing, I keep telling them, now you have to be strong. So if I see something wrong with them, I'll tell them. So they used to say that, hey, Dr. Hanna, you favor the girls. No, it's all for the whole of my trainees. But yes, I know we have started a female in surgery in Ethiopia. So, but we are not pushy enough to now we do have a lot of female surgeons in Ethiopia in all specialties, right? You were the first female orthopedic surgeon, Nani. So now we do have a few of you. And then me and Tete now are the first ortho surgeons. But a good thing is we have trained a lot of female surgeons also, female pediatric surgeons we do together with our seniors. And then, so it's expanding. The field is expanding as in female surgery. I mean, in Ethiopia, we are a lot now. We can make a change by training, by being a mentor to the younger generation of women in the future. So when you see, let's say the College of Surgeons of Eastern Central Africa, maybe some people might not know what College of Surgeons of Eastern Central and then Southern Africa. So it's a college which has 14 countries under membership, and also other countries are part of us as just a sister countries, right? So as a College of Surgeons, we take members by fellowship, by election, member specialist, or by examination. Like both of also you did a fellow by examination. Also I did a fellow by examination, and then we do have more than around 2,000 fellow by fellows in general. And then we do have 144 accredited hospitals under COSECSA, a training of COSECSA in the region. So it's the biggest college in sub-Saharan Africa for training of surgeons from all over. So we don't accept candidates only from the 14 countries. Also, we do have other countries like Niger, Gabon, Cameroon. Also, they send the candidates for an exam. So it's a big college, right? So, and then it's not a college-based training. It's a hospital-based training. So that's why we do have 144 hospitals accredited under COSECSA. So currently we do have, I would say, I'm not very good in memorizing numbers. We do have around 2,000 candidates which are under training under COSECSA. So it's a big college. So why I do become, and after a few years of become, fellow of College of Surgeons. So now I was taking part, this leadership thing would be new. Here it's not like a leadership. So I was during examination, I used to help, with the exam, like organizing the exams. When people go to COSECSA exams and then examine and then have a good time with your colleagues, I used to help the ECC chair, by then Prof. Abebe, and also the MC's panel head, to know what is going on, right? By going there with them, organizing till staying late and everything. So that's how it started, right? So, and then I have I've been with them for many years before I become the ECC chair, and I would say 3 years ago, right? So because I've been there every time, learned the process, exams and everything to say, okay, I can do that. So, and then the year I became it, so to be a chair or anything like that, you have to be there, you have to serve, and you have to prove yourself. So I said, okay, why not? I can do this. That's the thing. That then you will prove yourself through times that you can do it. So that's the the like a stepping stone for me to become the ACC chair in COSECSA. Right?
Interesting.
Like I didn't give you time to
No, I
to
love
say
that.
something.
Um, so the fact that I think obviously anything that has to do with education is where you can make the biggest difference, whatever level that is, right? Whether it's children education on children, whether it's adult education, it's the same thing. That's where you're going to have the biggest and most sustainable impact. So that's really what COSECSA is doing. It's elevating the standard of the member countries to a level that is globally competitive. Because that's the lens we need to look at. Because you see all this other college of surgeons, like the Royal College of Surgeons, American College of Surgeons, and we have all this College of Surgeons, and that's literally what they're doing. They're elevating the standard, the national standard, and COSECSA kind of the continental standard of how surgery is being practiced across different borders and countries. So it's very important, and the fact that you are playing this extremely important role in there is I think is very impactful, and the work you do will leave a print in everybody that has gone through COSECSA in the past few years through who became fellow through examination. And I also love that you mentioned it was a volunteer. You first volunteered, you were just there, you didn't get anything, you didn't get titles, you didn't get payment, you were just there. So that is very important for young people to understand that sometimes just being there is how you learn and how you build your confidence, because one source of confidence is knowledge. The more you know, the more confident you will be about that specific thing, right? So that's very important for young people to keep in mind. And I just want to make a comment on your students saying you favor the female trainees. And I am shamelessly supporting my female trainees, even female medical students. And I don't apologize to it, because it's about equity and equality. Yes, equality is great. All of you need to have the same opportunity. But there are so many things that have been stacked up against being a female in the medical field compared to being a male in the medical field. So to make it equitable, we need to give the females a little bit more support, just to give them the same level to compete with their male encounters. It's not we're trying to make women better. I mean, they will do that on their own. To be honest, it's just because they didn't get the opportunity. So we're just opening the door. So I am shamelessly always pro female training.
Shamelessly.
Yeah. So I love that you're doing that.
Mm.
And you balancing all these things that you talk about, because when let's just start from the COSECSA examinations. uh, every year it's in a different country, and it takes what, almost 3-4 days minimum for the whole thing to take place, because there are scientific presentations and everything, and then the graduation, the exam, the graduation, and everything. And then that happens every year, and that's just COSECSA. But you also have other leadership roles that you need to engage in, whether they're formal or informal. So that takes time. And then you're a surgeon, and then you're a mother, and then you're a wife, and then you're a daughter, and then you're a sister, and whatever, right? We as women just wear so many hats at different times. So what strategies or mindset help you navigate this intersecting roles without losing yourself in the process, and how do you balance all of it? I mean, if it is possible to even balance.
Yeah. So I think we do, yes, no, sometimes you might not be like, too busy to do that. For sure, is as you said, you need to balance your family life and work life, and also, so of course, COSECSA, the exam is just 1 week, right? But we do have the process an ongoing process. Fellowship applications, hospital applications is an ongoing process, and then there might be some scholarship that you're right. So it's an ongoing process that you need to plan. Okay, I will do these things during this time, right? I think the most important thing would be just planning, so that you have time for your things. Say, I would do, even if I can, sometimes emails would come, and then you have to do it. I would say, okay, I have planned. No, I would do this thing related issues on these specific dates, because you cannot do it. But if it's if it's very urgent, yes, I would do that one. Otherwise, I do balance the time in between. So the most important thing is I would say planning, because it will take your time. For, let's say, like while I was in Ethiopia, Addis, you do have pediatric surgery is a very busy department, right? So you'd be called at night, and then you would be there. You need to be there, and especially in the first few years where you don't have trainees to cover. So you need to be there every day, right? Every day and the night. And you have a family life on this side, that you have children, and then you have a husband, and everybody needs time from you, right? Also, as you said, your siblings, your parents would need time. So they normally, I would say, planning would be very important, so that you would not lose yourself in the process. So I would say planning is a major thing. So
Mm,
maybe we can also hear from you, like, how do you do it yourself, honey?
yeah, I love that you mentioned planning, because that's literally the best thing you can do, because you can't control other factors. So you just have to kind of work out how to do what and when. Um, I probably I would do the same. Planning is what it is, and also having a baseline understanding of what you want for your career and profession, but having that understanding with the people that matter in your life. Could be your husband, could be your child, could be your parents or your siblings, whoever it is, even friends sometimes, because you get to miss, like you said, you were at your friend's event and then you got a call and then you have to go, right? So there are so many human relations that are being sacrificed in order to stay true to the oath that we took as doctors. But it's just explaining that to people. And if you're lucky enough and you have people who understand what you want out of your career and your profession and what it takes and what it demands, then that communication on its own, that's 90% of your problem handled. And then, like you said, that 10% would be planning and then keeping everybody updated on the plan of what is going to happen. Don't you think so? I don't know. What do you think?
Yes, it gives sense. Yes, I totally agree with you.
Yeah. So we touched on education earlier when we were talking about COSECSA. So as an educator, shaping the next generation of surgeons, which is really a privilege to people like us, what future do you envision for surgical education in Africa, and how is COSECSA helping build that future from your point of view?
So, I would say COSECSA, the future is, like I said, COSECSA vision is, excellence, equity, and then innovation, right? So that are the most important things that you need to pillars of education. So so that is what we are striving for. Equity in terms of involving all the countries, ever that the communities are there, in terms of education for all the member countries, and equity in terms of involving female candidates, right? It's not by giving them extra grades or anything, but to as you said earlier, to push them to a certain level, so that that it should be equitable to everyone, and then excellence also, right? What we do as the exams is like to have a very good exam. We do standard setting of examination to make the exam right excellent one, and we do prepare exams in a like a cautious way, involving different panels, so that you'd have an excellent training with the outcome of a good quality surgeon for the region. So this is the future, right? So, and then also in terms of surgery education is in terms of skill, right? So every there is a criteria when you accredit a center where you do have adequate infrastructure for the trainees to practice in terms of skills. So we are also checking that and that's supporting the training. So this is I think to have a good, well-trained surgeon, a good quality surgeon in terms of skills and knowledge, and also to be equitable, and then also to the trainees should have there's a new the knowledge of these new innovations like minimally invasive surgeries, and then COSECSA to collaborate with different different college, different organization that are facilitating also the innovations that are like the rest of the world are. So that's it.
Yeah, I think I think one of the things that for me that I have observed when it comes to especially COSECSA, and its undeniable role, and maybe for me one of the biggest roles it has, is the fact that member surgeons trained in member countries can go work in other countries, in other member countries, as long as they're FCS or Fellow of College of Surgeons. And that's very important because sometimes, for example, in Ethiopia, we've been, in an odd way, lucky enough to have very strong training programs, whether it's a specialty or subspecialty programs, unlike other African countries. And, those African countries are getting there, but they need a little support. They need human resources. They need trained people. And we have been one of the countries that have been exporting trained professionals to these countries, and that is a huge impact. We're serving the people. We're involved in teaching. We're involved in putting together or structuring a whole training program, or sometimes even in institutions like Prof. Above would be the perfect example for that. So it's very important, and that power is unlocked because of COSECSA. And I always, that's one of the biggest thing that stands out to me when it comes to COSECSA. You, for example, where you're working right now, it's because of COSECSA. So all these things are very, very important and are crucial in order to elevate all the member countries to a level that would focus on safety and quality healthcare for the population. So I would applaud COSECSA especially for that part when it comes to its contribution towards education and many more other things, of course. So, you know, many listeners would look at you and feel intimidated because you're already where they want to be. You are a very well recognized and loved and respected pediatric surgeon in your country and in other parts of Africa as well. You have this important role in COSECSA. You're making an impact. You're confident. You're bold. You're a great example of what a mother would be, and all those things. So it could be very nerve-wracking to for somebody who's very young and just starting off their medical career. So what advice would you offer to someone who wants to be like you, who wants to lead from where they are, to become an everyday leader in their own sphere at the level that they're at?
Thank you, Annie, for that boost that you gave me at this time of the day. So I would say leadership, or everything in life would start with, I would say, influence, right? Not like authority. So you would start, but you should. My advice is start small, right? Start from wherever you are, but you should start to lead, right? To be very good in teaching your trainees. Start very small to be from leading, like around your colleagues and also. So like you have to invest you know in the process, in a leadership or in academic excellence. So it's a process. So I would say uh, you start by influence, not by authority, right? So and then it's start small, and then it will be a process for the young generation to be good in what you do. So I would say you don't need to wait for a permission of someone to be a good leader.
So finally, what would your message would be to young African women about the power of their voices, their skills, and their ability to create meaningful change, whether it's in their profession or beyond?
Should be there in every room that decisions are made, right? So you see some African countries where they put so many ladies in the position, and then sometimes some of the male count with these ladies are in position. Yeah. So and then they would say, okay, women's like this person put a lot of ladies into the leadership position because they wouldn't disagree to the decision, right? So you hear these comments a lot, right? So but you have to be there in every room where decisions are made, right? So that's the a very important thing that I say. Like as African woman, we have so many obstacles, right, from day one of our life. So to pass that obstacles to win, we need resilience, right? So and then we have to push, and then you have to pursue, and then you have to be strong. You can have so many um, like obstacles, so many negative energies around you, right? So that you have to push to reach wherever you want to be. And then like, and then I would say uh, as a woman, right? Like you used to hear, we don't we don't support each other. People would say that. So I would say you need to lift the other woman, right? We need to lift each other. We need to encourage each other to say, okay, just come and then do this. And then, so we need to lift up each other. We need to, as a woman, we need to support each other. So, and also we need to mentor each other so that would make an impact in women. So there is now this new mentorship program that was initiated by Operation Smile. So it said women in medicine in general, right? So you for mentoring young generation, actually those residents, young residents, and also like those who are like senior surgeons, but we were suggesting that we do it from young level, maybe from school age or medical students that you mentor. So and then as a woman, as said, previously we don't have many of the woman mentors out there, but now we do have woman mentors. So we should also do mentorship, which is very important for the younger generation to reach what we all are in the process. So I would say that they need to push and push, and also to prove what they are capable of doing as a woman, as a surgeon, or as a mother, or as a leader, and everything. It's just that you have to be constant. You have to pursue. You have to be very strong, and then you have to be truthful of what you are doing, right? And then you have to speak up what you can do, and then what you can achieve. This is the message I have for the younger woman.
That is beautiful. Thank you, honey. It's I think that's gonna inspire a lot of people. Just watching you do your thing have inspired so many of us, and I'm sure it's gonna inspire a lot of young women. Um, so thank you for being here. It has been a fantastic 1 hour, and I myself have learned a lot. And I really hope that people watching this would really see the female surgeon as a whole, how the female surgeon is a leader, how the female surgeon is an empath and an honest and authentic leader as a whole. So thank you so much for coming on the Everyday Leader.
Right. Thank you, Annie, for having me.